Hi, my name is Mary Chris, and I'm going to be doing the heart section on the head to toe assessment. At this time, the patient should be properly undressed. They need to be wearing either a gown or a tank top. My patient's going to be wearing a tank top. The first thing that the nurse always wants to do is to look for any obvious signs of problems. Is the patient experiencing shortness of air? Are they having chest pain? Do they have any obvious signs of edema in their extremities? Or do you see any jugular vein distension? These are all classified as problems to do with the heart, and you would need to first assess these problems, ask the patient about them, and then let that guide the rest of your assessment. But since my patient appears to be healthy, I'm going to start at the beginning and go to the end. The first thing that you always want to do first is assess the pulses, listen to make sure they're all there, they're symmetrical on each side, and that they're not absent. The first pulse is the brachial pulse, or the radial pulse, and this would be heard on the thumb side. You would listen to each one of those, and then the brachial, checking to see if they're symmetrical, you're not feeling any bounding or threading. When assessing the carotid pulses, you need to make sure and assess one at a time. Don't make sure not to press in too hard to cause the patient to have discomfort. If you were to assess both at the same time, it could cause the patient to have an episode of syncope. We don't want that to happen. And then the next pulse would be the femoral. That would be felt in the groin area. These should also be normal. This shouldn't cause the patient any discomfort at all. The next pulse is the popliteal, which is felt behind the knee. And it is normal to kind of firmly press. Sometimes it can be hard to find, but it's not abnormal. Make sure those are symmetrical, and then you'll want to check the posterior tibial, which is back here on the foot area. Make sure that those are symmetrical. And then the last pulse would be your pedal pulses, or your dorsalis pedis. Those are felt on the top of the foot. And the reason for assessing all these pulses is because you need to make sure that the blood is going all throughout the body. And if one was to be absent, you would need to make sure that they're present in other areas. Any pulse that is absent is abnormal, and that would need to be reported. When assessing pulses, you need to be grading them as well. A 0 when pressing down, that would be absent. You wouldn't feel it at all. A 1+ would be a weak or thready feeling. That means you would, when pressing down, you would have trouble feeling it. A 2+ is normal, and that is what my patient has. That's when pressing down, I can feel it right off. I don't have to push down really hard. A 3+ would be an increased or a full bounding pulse, and that's higher than normal. Once assessing the pulses, you would then move on to the blood pressure. You would assess the blood pressure. Since this is a cardiac assessment, I would want to do a manual pressure. And I would also assess in each arm. When assessing the blood pressure, you need to make sure that the blood pressure is within a range of 120/80. You need to, if there is a difference between the systolic and diastolic, you would need to document that. That would be abnormal. After assessing the blood pressure, you would then move on to the carotid arteries, or the carotid at the neck. You would observe for carotid pulsations, and that is just looking, and if you see any movement without even pressing on it, that is something abnormal. After observing, you will then place your fingers and you will palpate, like I said, feeling for them, making sure they're there. And then when assessing, you want to press firmly, but make sure not to press really hard, because that can cause the patient to be at a point of discomfort. And when assessing the carotid, you need to be assessing the amplitude of the pulse, making sure that there's a contour of the pulse wave, and if there are variations, what are they, what do they feel like, and document this as well. And once assessing one side, you always want to move to the other side, making sure that they're symmetrical, and if there are there problems on both sides or just one side? Once done with that, you would then move to the jugular vein pressure. I would have the patient lay in a supine position with the head of the bed elevated at 30 degrees. First, you're always going to observe. You're going to look for a rapid or a double wave of each heartbeat. When looking, if they do have jugular vein pressure, a majority of the time it is obvious. Anything less than 4 centimeters is normal. A lot of times when the light is on it, you'll be able to see it. Once observing, and if you do see it, you will then need to palpate it and feel for the highest point of pulsation. And like I said, it should always be less than 4 centimeters in a normal healthy adult. Now we're going to move down to the precordial movement. This is where the patient will also lay in the supine position, and you always want to examine from the patient's right side. And when examining this, you want to palpate first. And when palpating, you always want to, like normally this would be located between the 4th and 5th intercostal. So I would feel, and while feeling, you need to be feeling for any like extra feeling or extra things such as thrills or an exaggerated ventricle impulse. These are abnormal, and like I said, this is located at the 4th or 5th intercostal, and also known as the apical pulse or the point of maximal impulse. When feeling, you need to note the location, where it is, the size, and the quality of the impulse. Next, I will then move on and assess capillary refill. Capillary refill is where you will assess each of the limbs on the patient in their hands. You would take a finger, you'll press down lightly, and whiteness should appear, but it should go away within 2 to 3 seconds. You'll need to do this on each side. And then also you will assess it on both feet, making sure that is also 2 to 3 seconds. When assessing, like I said, it will appear white, but you need to note how long it takes for it to turn pink again. If it was to be greater than 2 to 3 seconds, this could mean that the patient has a form of peripheral vascular disease, some kind of arterial blockage, or they could be experiencing signs and symptoms of shock, and this would need to be reported and documented. After assessing capillary refill, I'm now going to be auscultating, which is listening with a stethoscope. The patient needs to be laying in a supine position. The head of the bed it can be elevated if you want it to. When auscultating, you always want to examine from the patient's right side, and depending on where you are, it's better to listen in a quiet room. That way you don't have any distractions and you can just focus on the patient and listening to their heart sounds. The first place that you will listen to will be that aortic. This is located at the right second interspace, and you would want to listen with the diaphragm. And when listening, you want to be assessing for any abnormal heart sounds, how the S1, S2 sounds, which I'll get to that in a minute, but be assessing for those as well. Once assessing for the aortic area, you would then move on down to the pulmonic, which is just directly across on the left side of the diaphragm.